Good afternoon, everyone. My name is Munzali Shamsu, an advanced resident Nigerian FETV. Today, I present our study titled Measles in Nigeria, Vaccination and the Association of Zero-Dose Status with Mortality from January 2024 to October 2025. Measles is highly contagious viral disease that causes high fever, rash, cough, and red eyes in infected people. It spreads via air, respiratory droplets or airborne particles when an infected individual breathes, sneezes, or coughs. In rare cases, it can cause severe disease or even death. However, measles infection is preventable through the use of measles-containing vaccine. Measles-containing vaccine is given in 2 doses. The first dose of measles-containing vaccine, known as MCB1, is routinely given to children at 9 months of age, while the second dose of measles-containing vaccine, known as MCB2, is required to be considered fully vaccinated. In Nigeria, MCB1 was introduced in 1978, while MCB2 was introduced during 2019 to 2021. Zero-dose children are children who have never received any dose of measles-containing vaccine according to vaccination history or caregiver report. These children are at highest risk of infection and even death because of large increases in zero-dose children globally during COVID-19. WHO, UNICEF, and partners launched the Big Catch Up campaign in 2023 to restore vaccination coverage to at least 2019 levels. Despite global control efforts, Nigeria is among the countries with highest measles burden and lowest vaccination coverage globally. In 2023, Nigeria Center for Disease Control and Prevention recorded 184 outbreaks and over 11,000 confirmed cases. On the right, we see a map of Nigeria showing northern states in blue and southern states in green. Vaccine hesitancy is higher in northern Nigeria compared to southern states due to cultural and religious factors. Northern Nigeria also faces insecurity of insurgencies from Boko Haram, banditry, and political clashes, which limit access to healthcare system. Although global evidence links zero-dose to worse outcome, but still there is limited association of zero-dose status and measles mortality in Nigeria. This study seeks to address that gap. This study had 4 main objectives. First, we described measles cases and deaths by time, place, and person in Nigeria from January 2024 to October 2025. We also compared measles incidence over the study period. Third, we estimated free balance of zero-dose status among confirmed cases. And fourth, we assessed whether there is an association between zero-dose status and mortality in Nigeria. The study was conducted in Nigeria and covering all the 36 states. It involved retrospective analysis of national measles surveillance data of all laboratory confirmed cases, epidemiologically linked and clinically compatible cases reported to IDSR from January 2024 to October 2025. We also conducted descriptive analysis of children with measles and deaths, evaluated their vaccination coverage, and performed multivariable logistic regression after adjusting for age, sex, and stage to identify risk factor of the mortality. This figure shows the age distributions of measles cases during the study period of time. As you can see, males are in blue and females are in red. The highest proportion of measles cases were ages 24 to 59 months, and approximately 60% of all cases were in children under 5. There was a slight male predominance among cases. Over the study period, measles incidence showed statistically significant increase from January 2024 to October 2025, indicating immunity gaps are widening rather than closing. This map also shows the distribution of measles incidence across Nigeria during the overall study period. The highest measles incidence is high or is concentrated in northern states, particularly Borno, Kebbi, Yobe, Zamfara, and Bauchi, while the southern states show relatively low measles incidence. This pattern is a reflective of lower measles immunization rate in northern Nigeria. This figure also shows the proportion of the confirmed cases who were zero dose. As you can see, approximately 3/4 of the cases were zero dose. This suggests that most infections occurred among unvaccinated children, and there is an important gap in immunization coverage. This figure also shows the proportion of those who have not received any dose of measles-containing vaccine shown in red, one dose shown in orange, the 2 doses shown in green. On the left-hand side is the cases in northern Nigeria, and on the right-hand side is the cases in southern Nigeria. Importantly, we can see that zero-dose patients predominate among the measles cases, and they are much more common among cases in northern Nigeria than in southern Nigeria. This figure also shows the case fatality rate on y-axis and number of doses of measles-containing vaccine on x-axis. The message here is clear. The more doses of NCB you have, the less likely you are to die from measles. Vaccination saves life. Zero-dose children face significantly higher odds of death. After adjusting for age, sex, and state, the adjusted odds ratio showed that zero-dose children had more than 2 times higher odds of death compared to those who received 1 dose or 2 doses of MCB. Under 5 children had about 1.5 times higher odds of death compared to children who age 5 years and above. We also see that being 5 years or older and being female were associated with decreased risks of death from measles. In conclusion, this study reveals high frequency of zero-dose cases among children under 5 years with measles in Nigeria. Northern states carried a disproportionately higher burden of measles. Prevalence of zero-dose cases is increasing over time. Being zero-dose more than doubles the risk of death from measles. We recommend the government of Nigeria to prioritize targeted vaccination campaign for zero-dose children in high-burden states in northern Nigeria to close immunity gap and to reduce measles transmission and death. Thank you for listening.